Hello, I'm Urvashi Kapoor and welcome back to the Daily News Bulletin of Jagran English. Let's begin with the first big story of the day. A Chief Justice S.A. Bobde-led Supreme Court bench today said that the petition of one of the 4 death row convicts in Nirbhaya case who has challenged the rejection of his mercy petition should be listed on top priority if execution is on February 1. CJI S.A. Bobde asked convict Mukesh Singh's counsel to approach the Supreme Court registry for urgent listing of his petition challenging the rejection of his mercy petition by President Ramnath Kovind. Mukesh's mercy plea was dismissed by President Ramnath Kovind on January 17. The warrant for execution of death sentence for the 4 convicts in the case has been fixed on February 1 at 6 am. Singh had moved the mercy petition after the Supreme Court had dismissed his curative petition against his conviction and death sentence. The apex court had also rejected the curative petition of another death row convict, Akshay Kumar. The other 2 convicts, Pawan Gupta and Vinay Kumar Sharma, are yet to file curative petitions before the Supreme Court. This comes day after Delhi court said that no further directions were required on a plea by the lawyer of the death row convicts, alleging the prison authorities were not handling over certain documents required to file mercy and curative petitions and disposed of the petition. Additional Sessions Judge Ajay Kumar Jain said the convict's lawyer can take pictures of the relevant documents, diary and paintings from the Tihar jail authorities. The court had noted that the jail authorities had already complied with the request made by the convicts by supplying the documents, whatever was lying with them. The government today announced its plan to sell the entire of its stake in Air India. According to the bid documents, the Air India would sell 100% stake in low-cost Air India Express and 50% shareholding joint venture Air India AISATS Holding Limited. The government has set March 17, 2020 as deadline for submitting expression of interest, adding that any bidder would have to agree to assume roughly $3.26 billion USD in debt and other liabilities. This is the second time in less than 2 years that the government has come out with proposal for selling stake in Air India, which has been in the red for long. Air India AISATS Airport Services Private Limited is an equal joint venture between Air India and Singapore Airlines. It offers ground handling services. Air India also has interest in Air India Engineering Services, Air India Air Transport Services, Air India Elite Services and Hotel Corporation of India. These entities are in the process of being transferred to a separate company, Air India AISATS Holding Limited, and would not be a part of the proposed transaction, the document said. According to the document, debt of Rs 23,286.5 crore would remain with Air India and Air India Express at the time of closing of the disinvestment. The remaining debt would be allocated to Air India AISATS Holding Limited. Ernst & Young is the transaction advisor for Air India disinvestment process. In 2018, the government proposed to offload 76% equity share capital of the national carrier as well as transfer of the management control to private players. However, there were no bidders. The death toll due to the deadly coronavirus has climbed to 80 in China with 2,744 confirmed cases reported till date, said the country's National Health Commission today, while adding that the condition of 461 people treated for virus is critical. The commission further said that during past 24 hours, 769 confirmed cases, 3,806 suspected cases and 24 deaths from the disease was reported. However, 51 people have recovered from the disease, but 5,794 people remained suspected patients, said the commission. Apart from China, the deadly coronavirus has also been reported in Thailand, Australia, Singapore, United States, Republic of Korea, Japan, France, Malaysia, Vietnam and Nepal. Suspected cases have also been found in India's Rajasthan after a doctor who returned to India after completing MBBS course in China was kept in isolation at a hospital. Rajasthan Health Minister Raghu Sharma said a blood sample of the patient was sent to the National Virology Department in Pune, adding that a total of 18 people from 4 districts of the state had returned to the country from China, and the respective district chiefs and medical officers were directed to keep them under surveillance for 28 days. The coronavirus is the large family of viruses that causes illnesses ranging from the common cold to acute respiratory syndromes, but the virus that has killed people in China is a novel strain and not seen before. Common symptoms of the novel coronavirus strain include respiratory symptoms such as fever, cough, shortness of breath, and breathing difficulties. With this, I conclude the Daily News Bulletin for today. We'll be back tomorrow with more big stories of the day. You can log on to english.jagran.com to catch all developments of the day. You can also follow us on Twitter, Facebook, and YouTube. Thank you and goodbye.